The World Meteorological Department has issued a warning that the health risk due to extreme heat is increasing, and the world should brace itself for more intense and frequent heat waves. Now, according to the World Weather Body, the intense heat is in its early phases, and it is expected that the mercury could touch and go consistently over 40 degrees Celsius in North America, Asia, North Africa, and also the Mediterranean. Now, as per the United Nations Agency for Weather, prolonged heat waves can result in an increased risk of heart attack, which could lead to death. Now, the International Red Cross has said that if infants, elderly people and people with chronic health conditions are at risk, and experts have said that nearly about 60,000 Europeans may have died in the heat wave last year. You must hear that figure again. 60,000 Europeans may have died due to the heat wave last year, despite having some of the world's best early warning systems.
So we are seeing continuing growth in the frequency, duration and intensity of heat waves. And this is entirely consistent with the science of global warming and IPCC reports. These events will continue to grow in intensity, and the world needs to prepare for more intense heat waves. The recently declared El Nino is only expected to amplify the occurrence and intensity of extreme heat events. So we're in for a bit of a ride, I'm afraid, and they will have quite serious impacts on human health and livelihoods.
Meanwhile, amidst the rising temperatures, Italy's hospitals have reported a sharp rise in the number of emergency cases that they have to deal with. As Rome has recorded temperatures of over 41 degrees Celsius, some hospitals have reported a 25% spike in the number of patients who are arriving into emergency units suffering from issues such as dehydration and other illnesses caused by overexposure to heat. The temperature in Rome has broken the earlier record of 40.7 degrees Celsius that was set in the month of June last year. Now, to give us more perspective in terms of how this heat wave is impacting the health of people in general, we're being joined by Dr. Nikolai Petrovsky. Now, Dr. Petrovsky is a public health expert and a research director at the Vaccine Private Limited, and is also the director of endocrinology at Flinders Medical Center. Now, Dr. Petrovsky, thank you very much indeed for joining us here on WION. And let me just begin by asking you this. As the summer season has set in and mercury has touched new records, more and more people are expected to suffer from conditions due to exposure to heat. How should people deal with this?
Well, so the best way to deal with it is prevention. So be aware that the temperatures are going to be high. People should be limiting their exposure, particularly not doing any exertion during the day when the heat is greatest. They should be restricting those activities, particularly exercise, to times in the day when the heat is less intense. They should be making sure they have access to water. And if they have elderly relatives, because really people who are elderly and have heart disease are at the greatest risk, they need to be making sure that their relatives are staying cool, that they have access to water, and most importantly, that someone is checking in on them regularly to make sure that they're not getting dehydrated or overheated.
Right. And also the fact that this report by the United Nations has said that more people could suffer from heart attacks caused due to exposure to heat. This is difficult for a lot of people because not a lot of people are aware that going out and staying in very hot temperature for a prolonged period of time could result in a heart attack. Is there something that the government should be doing to make people aware about these aspects of extreme heat waves that countries are suffering through?
Yeah, so we have to remember that when we get dehydrated, our heart rate goes up. And of course, when your heart rate goes up, if you have a blockage in one of the arteries of the heart, then that's going to cause the heart not to get enough oxygen. So there is a direct link between dehydration and increased risk of heart attacks. As well as that, the dehydration makes your blood thicker, and therefore the blood's much more likely to clot. So we know that people with heart disease are at very high risk if they get exposed to high heats. And I agree, this needs to be communicated to the community, and anyone who has elderly relatives with heart conditions needs to look after those relatives and check in on them regularly during these heat waves.
Absolutely indeed, Dr. Petrovsky. Thank you very much indeed, sir, for joining us and getting us all those insights there. WION is now available in your country. Download the app now and get all the news on the move.